This video is solely for the purpose of providing information to users of ModelMed International training models in the correct use and care of those products. They do not intend to show correct clinical techniques and must not be used in any way as a clinical training guide. How to use Sophie and Sophie's mum to simulate a cephalic birth. Before using Sophie's mum, make sure she is thoroughly lubricated with a water-based surgical lubricant throughout the entire birth canal. KY jelly works very well. Please note that ultrasound gel does not work at all and should not be used. 1 or 2 squirts of water can help make the inside even more slippery. Now cover Sophie with a generous quantity of lubricant from head to toe on both the back and the front. Lie Sophie on her stomach and slide her head into the pelvic brim in the transverse position. Once inside the pelvis, put your hand beside her ear and swing the head to the midline. Place your hand on her buttocks with your thumb between her legs. Now lift her bottom right up and push down to move her around the curve of Caris. You must proceed firmly but gently. Once the head emerges, you can apply a gentle twist to Sophie's pelvis to help the simulation of restitution. The internal shape of Sophie's mum's birth canal will do the rest of the work. In this special cutaway model, you can see how the head is introduced in the transverse position. Then the head is swung from the transverse to the midline. Note how the buttocks are lifted up before Sophie is pushed downwards through the birth canal. Here we see how a twist is applied to the buttocks to aid restitution. Again, in a side view, look at how high the buttocks are lifted up and the angle at which Sophie is pushed down into the birth canal. This is the fundamental technique to making the Sophie birth relatively easy. The most common error is to push across towards the vaginal opening rather than down and around the curve of Caris.